Minister, in 2022, the mental health budget was 1.1 billion, and by my reading, there were about 4,000 children awaiting CAHMS mental health services. And then the following year, the mental health budget rose again by about 100 million, but so did the number of children awaiting services. And in 2024, we saw the same thing where the health budget rose again, but the number of children awaiting those services rose to about 4,400. So my question is, now that we're spending 1.5 billion on mental health services, why would we expect the outcome to be different to those previous years? And is it not the case that money isn't necessarily the issue here?
Thanks, Ben, for your question. A very valid question. So the first thing to say is we have now 1.2 million young people living in the country. We have seen a huge increase in relation to that, about 200,000 increase over the last 5 or 6 years. The one thing I can say is the amount of young people now waiting for access to CAHMS has fallen to 3,300. We have seen, since we put in place the new Child and Youth office in the HSE, we have prioritised over the last 18 months additional staff, a waiting list initiative, and we have seen that borne fruit. And I also want to talk about the 76 CAHMS teams, the length and breadth of the country, because 225,000 appointments were issued to young people last year, young people that would have true CAHMS teams. So we're doing a huge amount of work to reduce the waiting list. And I am delighted to say as well that when we have, a child, very, very complex, a situation where a child is in extreme danger, that 93% of all children are reacted to within 72 hours. So the funding I receive in this year's budget will make a huge difference, because I am very, very clear that a geographical spread for the whole time equivalence that I secured will go to different CAHMS teams all over the country to enhance them and to make them as strong as ever. And we're particularly putting a focus on long waiters.
So is it the case that the figures are actually following? Are my figures incorrect? They may well be. I'm wondering. That's what I saw here. But as I say, I could be wrong.
Yeah. So the latest figures I have are we have a reduction of this was in July of this year. These are the latest figures: 3,300 children. So we're delighted to see that. At that time last year, in 2022. It was 4,400 children. So we have made a lot of progress, but we have more to do. I acknowledge that.